Brian Lehrer on WNYC, and as the new school year begins, here's something to watch out for, especially if you're a college freshman or the parent of one. Mental health problems often express themselves for the first time in freshman year. In general, about half of mental health problems tend to show up between ages 14 and 24, according to an article on Huffington Post, and freshman year is an especially common time. Let's talk about why and what to do about it. Dr. Sederer, is there a common pattern of anxiety or depression coming to the fore in freshman year, and how does it usually express?
These are the years, as you said, when illness is at greatest risk. So when you combine risk with stress, the stress of going off to school, the stress of leaving home, the stress of all the social and sexual demands and pleasures, if you will, of college, and the academic demands, and the use of alcohol and drugs, the ultimate solvent, the ultimate disinhibitor, these all come together and put these at-risk youth at risk to become ill with these common mental disorders.
We have some really interesting caller questions and experiences. We'll get to Peter in Minnesota, Isabella in Eastern Queens, but here's an anonymous caller from Greenwich, Connecticut, and feel free to call in anonymously on topics like this, really on anything. But thank you for calling. Hello.
Hi.
What happened to you?
Well, my assorted illnesses had been noticed long before college. I was diagnosed with ADHD when I was 11, and then towards the end of high school, a whole array of things, depressive disorders, bipolar spectrum, and then when I went off to my freshman year of college, nobody had really understood the extent to which that would affect my ability to self-govern and manage my time and really do anything that's necessary to have a successful college experience. So without my parents there and doctors and assorted external motivators to say, remember to take all your pills in the morning, remember to do your homework, this, that, and the other thing, it was catastrophic, and I ended up having to withdraw from the university.
So what's the lesson of your experience for others who still want to be able to go away to college?
The important thing is to really take a very close inventory of everyone in your life who's helping you succeed up to that point, and make sure you have a similar framework in place at college when you leave. I mean, my freshman year was 4 years ago. I'm still, barely a junior. And I'm only now learning, actually, 4 years later, that what my real problem was anxiety and avoidance. So it's important to have a thorough understanding and a clear understanding of what it is that's affecting you, and then make sure that you have a mirrored framework at your university to help you have a successful experience.
Thank you for calling in. Thank you so much. I'm sure that's going to be helpful to some of our other listeners. Dr. Sederer, I'm going to ask you one other thing before you go. Is a certain amount of kind of freaking out when you first go away to college and you're that age kind of normal and okay?
Well, freaking out is all right, provided it doesn't get in the way of your being able to be a student, doesn't get in the way profoundly in terms of your being able to develop the kind of relationships that you want to have in school and on a path to a future. So we all have moments where we say, "Oh my God, what is this all about? What am I in the middle of?"
Because despite all these real concerns and real stories that we've heard from people, you also don't want to over-medicalize normal adjustment periods.
Exactly, and there is a difference between an illness and an adjustment.